Hi there. If you're watching this video, most likely you have had a surgery for implant or implant and bone graft in our office. It is very important to follow all the instructions given here for a fast and recovery without any complications. Generally speaking, if you have gotten only an implant placed, there is no pain and no discomfort involved. Only the soft tissue around the implant would be a little bit sore for a day or two. However, if you have had bone graft as well as implant or just a bone graft procedure, 3 to 4 days of pain is expected, and we always give medication which alleviates the pain quite a bit. Whenever bone graft procedure is done, we always prescribe antibiotic, and it is extremely important for you to finish your antibiotic and take it on a timely manner. In case of implant and bone graft, generally speaking, bleeding is extremely rare. Usually we do use membrane as well as putting stitches there, and it's highly unlikely that you would bleed unless you exert yourself in extreme physical activity such as exercise, jogging, or lifting really heavy things. In case you do get bleeding, you're going to have a packet of gauze. It is very important that right away you moisten it so it doesn't stick to the gum and the tissue. Place it over the implant site that is bleeding and bite down. It is the pressure of your bite that stops the bleeding and not the gauze. After an implant placement, we always ask the patient, do not drink any alcohol and do not smoke for 3 days. It is very, very important that you follow this in order not to have pain and discomfort. The day of surgery, you're not going to brush your teeth, you're not going to use any mouth rinse. The day after, you can brush rest of the teeth and the other area with little toothpaste, not too much, and you can start rinsing with warm salt water. Sometimes we also give chlorhexidine rinse post implant placement surgeries. Do not use any other rinse. It is very important to stick to the regimen of the warm salt water. If you do have high blood pressure, only warm water. Eliminate the salt. You're not going to spit forcefully. It is very important that you just rinse and let it drop in the sink. You're going to be given medication either as a prescription or in the office. And generally speaking, it involves both Tylenol as well as ibuprofen or Advil. Each of them work on different pathway to block the pain. So it is important that you follow our instructions and take them as recommended. It is extremely important for you not to touch the area of the surgery with your finger. Basically, a lot of patients try to see if it is still sore or not, or with your tongue, because the tongue has its own mind and it does go to the area exploring what has happened. This often happens a few days after surgery when the pain has subsided and tongue starts feeling comfortable to explore the area. It's very, very important not to untie the sutures with your tongue and do not move the membrane and the grafting within the area of the surgery. And lastly, we will give you a post-op instruction written on a paper, as well as my cell phone number. You can call me or text me at any time. And if you have any questions or if you have any emergencies, it is very important that you do write your name on the text as well as what procedure was done, because we do different surgeries in our office, and that way I will remember and instruct you much easier. Thank you very much for watching this.